checkpoint inhibition immune therapy is a useful strategy for triple-negative breast cancer. We've seen single-agent activity with different checkpoint inhibitors. We know that PD-L1 can inhibit the immune response in cancers. And we know that in triple-negative breast cancer, most of the PD-L1 expression is in immune cells. So the IMPassion130 trial was the first phase 3 study with a combination of chemotherapy, in this case nab-paclitaxel, with atezolizumab compared to placebo in patients with metastatic triple-negative breast cancer. You've seen the trial design. Patients were not pre-treated first-line therapy for metastatic triple-negative breast cancer and were randomized 1-to-1 between nab-paclitaxel and placebo and nab-paclitaxel and atezolizumab. Stratification factors were taxane use, liver metastasis, and most importantly, PD-L1 expression, which was defined as at least 1% staining on immune histochemistry. The trial had 4 co-primary endpoints, 2 for progression-free survival in the intention to treat analysis and in the PD-L1 positive subgroup, and then secondly in overall survival in the intention to treat population and then PD-L1 positive subgroup. We're presenting here final data for PFS, both for ITT and for the PD-L1 positive subgroup, and the first interim analysis for OS with further interim and the final analysis to be expected in the near future. If we look at the primary endpoint of PFS in the ITT population, you see a hazard ratio of 0.8. This is statistically significant. Median progression-free survival increased from 5.5 to 7.2 months, with 1-year progression-free survival rates going up from 18% to 24%. If you look at the PD-L1 positive subgroup, we see an increased benefit with a hazard ratio of 0.62, p-value of less than 0.0001, PFS improving from 5 months to 7.5 months, and the rate of patients who are progression-free at 12 months going up from 16% to 29%. If you look at the interim analysis for overall survival, there was no difference in the ITT population according to the predefined criteria, with a hazard ratio of 0.84, p-value of 0.08. If we look at the Kaplan-Meier curves in the PD-L1 positive subgroup, as you can see, there's a hazard ratio of 0.62. The median overall survival for patients receiving placebo at this time point is 15.5 months and 25 months for patients receiving atezolizumab. The follow-up at this time was only 12.9 months in the survival group, and this was not formally tested due to statistical design. Looking at the most common adverse events, they were similar between both groups. The most common adverse events were down to common side effects of chemotherapy. There was a small increase in the rate of peripheral neuropathy with atezolizumab compared to placebo, which we believe is down to a longer use of nab-paclitaxel in the experimental arm. So our conclusions are that IMPassion130 is the first phase 3 trial to demonstrate a benefit with first-line immune therapy in triple-negative breast cancer. Atezolizumab and nab-paclitaxel resulted in a statistically significant benefit in PFS, both in the ITT population and the PD-L1 positive population, with a hazard ratio of 0.8 in the ITT population, and a clinically meaningful benefit in the PD-L1 positive population with a hazard ratio of 0.62. At this first interim analysis, there's a clinically meaningful improvement in overall survival with atezolizumab in the PD-L1 positive group, with a median improvement from 15.5 months to 25 months, hazard ratio of 0.62, but please note there's no formal testing per hierarchical study design. Atezolizumab and nab-paclitaxel were well tolerated with a safety profile consistent with each agent. Thank you very much.